Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Okay, please introduce myself. My name is Dian Hudiawati, one of member team from this study. I would like to present our result about the entitled prevalence analysis of intestinal worm infection in pregnant women in the working area of the Gatak Public Health Center, Central Java, Indonesia. I would like to introduce our team. The first is Ibu Sulastri SKP MKes, and me, Dian Hudiawati. The third one is Ibu Siti Arifa SKP MKes PhD. And the fourth one, Ibu Winarsi Nur Ambalwati SKP Nurse ETN MKep. And our student, we have two students here that were Widya Putri Rahmawati and Anindiati Fatihul Jannah. Okay, for the background in this study, it's about worm at the pregnant woman. Worms are an endemic and chronic disease caused by parasitic worm with a high prevalence. Worm cause many losses as it decreases the absorption of macronutrients from the pregnant woman, diminishes the amount of blood circulated also. The iron deficiency prompts an expanded dangers of confusion during pregnancy, labor, and puerperium. As we know, in the Gatak Community Health Center admitted that during their pregnancy, they had never been examined for worm. So that's why for that reason, we conduct this research to know the prevalence of pregnant women that infected the worm. For the method, our study design was descriptive analytic design with the sample and setting consists of 232 pregnant women. And our data collection for this research was conducted from January to March 2021. The sample was collected by examining the sample of pregnant women's faces and door-to-door, then checking to employ the Harada-Mori method. And the data analysis used univariate analysis that describing the characteristic of pregnant women and determining the prevalence of worm in pregnant women. And the result, we found the characteristic of the respondent that consists of age, parity, occupation, education, and gestational age from the pregnant woman. For the age, most of the respondents were in the productive age, that was 20 to 35 years old. And the parity status, the majority of the respondents were primiparous. And the occupation of the respondent, most of them were housewives. And the level of education, most of respondents had a high school education, and the gestational age were third trimester. So the final stage of pregnancy. And the result, we found the worm pregnancy of the pregnant woman. The total of 232 respondents, we found that consists of 39 respondents had worm with the prevalence around 16.8%. Still few amounts, but we should aware with this sign. And then of the 39 respondents who were positively infected by worm, there are 8 respondents, around 20.5%, show sign and symptom of anemia. So this is this sign should give us aware for the pregnant woman. The 39 respondents that infected by worm have the characteristic that are around 6.4% were infected by Ascaris lumbricoides. The second one, 6%, were contaminated with Ancylostoma duodenale or hookworms, and 2.2% were infected with Trichuris trichiura, and 2.2% were affected by Enterobius vermicularis. According to that result, we found that our outcomes show that there were pregnant women who were contaminated with worm and experienced anemia. The perceptiveness obtained was 16.8%, even though it was as yet in the low class. Worm disease is exceptionally hindering to pregnant women since it can meddle with the interaction of retention of supplement, others that it can likewise cause anemia. With the increasing incidence of anemia in pregnant women, preventively medical examination can be supplemented with helminthiasis to prevent infection, and in the event of an infection also. Treat it promptly to avoid the complication during pregnancy and childbirth. So, for the primary health centers care, they should aware with this result, because still there is the pregnant woman that infected by worm like that. Okay. It was our presentation for our study result. Thank you for the attention. If there is a wrong word, I'm so sorry. And would say wassalamualaikum warahmatullahi wabarakatuh.